I'm an endocrinologist and I work in San Jose, and I have another office which is close to the regional medical center, but I'm with El Camino Hospital. And I primarily treat uncontrolled diabetes, but I also do have a passion for diabetes at any stage of when it is, including in the pre-diabetic stage. I come from a family that has a lot of diabetes, and in fact, my father-in-law passed away from diabetes and a heart attack, and both my parents are diabetic. So I think it's been around for a long time, and it's a topic that is very near and dear to me. So I will start. So a lot of people come with diabetes. Many know kind of what it is, and some people don't know what it is. So diabetes essentially is when glucose in your body cannot be consumed in the proper way because either of a lack of insulin or insulin which is there but just not able to do its job properly and transform glucose into energy. When a person walks into my office and they say that their sugar was found to be high a week ago, technically they might have been diagnosed at this stage at the 0 point, but they really started having it about 10 years ago. And so the first thing that actually starts creeping up slowly is your after meal blood glucose, this orange line here. It starts going up first. So the sugars that start rising are the ones that are after you start eating. You eat the meal and then the sugar starts going up. It's not the fasting blood sugar, it's not the morning blood sugar that goes up. But to contradict this, most people actually check only their morning blood sugars. But the one that you really want to check is the post-meal sugar if you want to find out that if you have diabetes. So on the bottom, you see this word beta cells, and they come from the pancreas. They secrete insulin. And as we go in time, the beta cells, they dwindle. And they dwindle for everyone. It's just that the rate of dwindling is a lot higher when you have diabetes. So as you see that by the time you actually are diagnosed, you've lost 50% of these beta cells. They're already half gone. And so by the time you're 5 or even 10 years into it, you've lost most of your beta cells and your insulin levels have gone down tremendously. You develop what we call insulin resistance, which is this greenish turquoise line that starts developing and then sort of starts plateauing out. And so you do have insulin, but it's not working very well because you have insulin resistance, which I will talk a little bit more about later. In the process of having beta cell failure, you start having uncontrolled blood sugars, which we call uncontrolled hyperglycemia. So when we talk about people with diabetes, diabetes comes in various phases of life. It also has different causes to it. So there are genetic causes, which come from your parents, which come from the environment that you're around. It comes from what you eat. It comes from whether you move yourself or not, whether you're physically active or not. So these are the kind of things that impact whether you would be getting it or not as you go along. Obesity definitely increases your risk for it. It also increases your risk for insulin resistance. And the initial phases, the body is able to overcome it. You would have a rise in sugar and the insulin is able to get secreted and take care of it. And it produces something called impaired glucose tolerance. That means your sugars don't quite become as high as what a diabetic is, but they're still very, very high. And that actually has a lot of association with what we call the metabolic syndrome, with what we call atherosclerosis, which is basically clogging of your blood vessels in your heart, which leads to heart attacks. It also causes high blood pressure. It causes all these what we call microvascular changes. There are small vessels in your body which basically affect the eyes, which is retinopathy. It affects the nerves, the neuropathy of your feet and your legs. And then it affects your kidneys, which are nephropathy. And as these complications keep going on, you start developing blindness, kidney failure, heart disease, and people lose their limbs. So this is the way the progression of diabetes goes until you sort of become very disabled and eventually um, die and succumb to death. So it's a disease where you could live with it, and sort of when it creeps up on you, it's kind of hard for it to um, disappear on its own without some kind of intervention. And cracking the wellness code and this whole association is meant for reversing diabetes. So you don't want to go into this direction at all. You want to start cutting it off as soon as you even maybe are in the early phases right here. When you start developing insulin resistance, when you start developing obesity, or you know that you have bad environmental factors or genetic susceptibility, that's the time to change. So what is insulin resistance? We keep talking about it. So insulin is needed. Insulin is your key. It needs to go into push the glucose into the cell wall. And that key needs to fit into this hole in order to push this glucose into the cell. But if this hole is entirely clogged up with all the cholesterol and everything that you've eaten, it just doesn't let that key fit in, and the glucose doesn't go into the cell. So essentially, if it doesn't push the glucose into the cell, the glucose starts lingering outside and it causes the damage that we talked about. And that is insulin resistance. So in a person who doesn't have diabetes, if you need one, so usually insulin comes in units. So if it's 1 unit of insulin will drop somebody's glucose by 50 or 60 points, then somebody who has diabetes, 1 unit of insulin might only drop glucose by 10 points because you're so insulin resistant that it's not able to push that glucose into the cell. I hope that's clear. So when we start thinking of insulin resistance, it comes mostly from diabetes. And where does diabetes come from? It mostly comes from what we consume, a lot of it. Now, if you see that this drink of Coca-Cola, which we think, oh, it's only a can of soda, once in a while, it won't cause much of harm to me. It has 9 tablespoons of sugar. Now, that's a lot of sugar. Now, if you see the Nestea, which probably looks very harmless, most people come and tell me, oh, I just have this nice sweetened tea, and that has almost the equal amount of sugar. And all these drinks, they have a lot of sugar, except for our wonderful friend, water. So the best thing that you might want to start drinking is water. So how do we diagnose diabetes? How do we even know that we have it? So pre-diabetes is between 100 to 126, more than 100 or equal to 100 and less than 126 in the morning. The minute you cross 126 and above, you have diabetes. If you're less than 100, you're normal. So you wake up in the morning and you're 98, you're normal. You wake up in the morning and you're 110, well, you might be heading in the pre-diabetes stage. And if you wake up and you're 130, then you probably have diabetes. So you want to do a 2-hour glucose tolerance. And this is something that your doctor has to prescribe for you. It's given with a drink, and then you go to the lab and you check it after 2 hours. And if it crosses 200 or more, you have diabetes. If it's between 140 and 200, then you have something called impaired glucose tolerance, as we talked before. And if it's less than 140, then you're normal. So now you know the numbers. So why do we care whether we're 140, 200, as we talked before? The higher you go as an A1C, so an A1C, I don't know if I actually put that slide in, but an hemoglobin A1C is an average of your blood sugars for the last 3 months. So that number, once you would like it to stay lower than 6.5. And the higher it goes, as you can see, it goes to 10 and above, or it goes in this yellow one or green, wherever it goes, the higher it goes, the more chances you are developing all the microvascular complications of diabetes, infecting the eyes, the kidneys, the nerves, and protein getting spilt out in your urine. So a lot of people come to me and they talk all kinds of things about diabetes that they've heard. And a lot of it is, they're myths, diabetes. Somebody said, if you eat too much sugar, it causes diabetes. If people with diabetes, they should not exercise. You can catch diabetes from another person. Somebody said it's not a serious disease, but it is. It's very serious. We just talked about it. Somebody said people with diabetes need to follow a special diet. It's not a special diet. It's more of the same foods, except it's a healthy diet, which all of us should be following. And is it possible to have just a touch of diabetes or little diabetes? There's nothing like a touch. It's like you can't be just a little pregnant. You have to either be pregnant or not be pregnant. So diabetes is something like that. Um, you have to lose a lot of weight for your diabetes to improve. Actually, there's some good news. You can lose just 7% of your body weight, and it'll cause that's about 15 pounds, and you will find that your diabetes improves. So, all the things that people think about, like, these are diabetes is something that once you develop it, you can live with it. You can make it much better for yourself. You could change your lifestyle. Your lifestyle becomes your number one friend. You change your lifestyle, you exercise. Unfortunately, you can't change your genes. We can't change our parents or any of our lineage, but we can change other things around us to make things better. Now, there are lots of herbs. A lot of people with diabetes, they come and ask me, "Oh, if is it okay if I just have some cinnamon, or if I have bitter melon, or I'm going to have some, one of these other ones, and that's all I need." Well, if your diabetes is in a really high range with the sugars in the 300s, the herbs are not going to solve your problem. You will need something to bring it down, but herbs will help you. So you don't want to use this as just as your alternative. Okay. So now there are so many diets out there, right? You have a low carb diet, you have a ketogenic diet, you have a low fat diet, you do intermittent fasting, you go to Weight Watchers, you get a paleo diet, or whatever. All the kind of diets, essentially what you're trying to do is you're creating what we call a caloric deficit, which means you're just basically consuming less food. And then that less food it depends on what it contains, whether it contains a lot of carbs or it contains no carbs, or it has a very high in fats and proteins, or you're restricting the amount that you're eating when you're eating, or you're going to Weight Watchers and you're getting it's some kind of a point-based system and you're getting awarded for what you're eating, or you're eating a Paleolithic diet. So it depends on kind of what is the fashionable thing to do, but the best one around is your intermittent fasting, by all means. Ketogenic diets are very, very popular, but remember they have a lot of fat, which is not exactly a very healthy way to go. So when I think of patients with diabetes, I think of a few things that come to my mind. And one is that I would always want to know what my sugar is. And so I have to check my sugars. And then in order to treat my sugars, there are just two things I can do. Well, three things. I would exercise. My diet is very important. And then what kind of medications I would be on. Now, as far as exercising every day, half an hour, 45 minutes, all, if you can do it all 7 days, it's great. But if you can do 5 days a week, 150 minutes would be pretty good. Um, when we talk in terms of eating well, we'll talk about intermittent fasting. And then the third was, how do you treat it? And that's a little long topic for this talk, but it would be either oral medications or it would be insulins, depending on where you are in the stage of diabetes. Not everybody who goes on insulin is a type 1 diabetic. That's something to remember. So, what are the benefits of intermittent fasting? Essentially, intermittent fasting is when um, you eat for 8 hours and you fast for 16. So you would eat between 10 to 6 or 11 to 7, and you would fast from 7 to 11 or 6 to 10, whichever way. And they say that everything that you eat in the evening after 6 p.m. goes into it gets stored as fat, essentially. So the earlier you eat and the earlier you stop eating is actually the best. It does all these positive things for you. It stimulates your brain function, improves your heart function. It'll increase your fat metabolism. It improves this glucose tolerance, promotes weight loss, and everything. And so it's very important that you want to be fasting for 16 hours and you eat for 8. You could start slowly and then expand it to that level. Now, as we talked before, nobody goes and spends money without knowing how much money you have in your bank, correct? So your bank is your blood sugars. And how do you know them? You have to keep a log. It's very, very important. In fact, I have patients who come and see me, and if they don't bring their meter or some form of a log, I don't see you. Because it's like if you had to take your car for service and you don't take your car, they can't do anything for you. So it's the same way. It's very important you take your sugars with you so there's something to see. And it's important to check them pretty often as well. And we'll talk about that. So this is the older style of doing it where you poke yourself and you put the strip and you put that little piece of blood on it and you get a number. And most of the meters work exactly in the same way. The amount of blood that you need for it is a little bit different in some of them. But essentially that's how they work. And when you're checking with your meter, you're checking at one time in the day. So when you check in the morning, then you may check one more time in the day in the evening. And those are the only two numbers that you have available. So, but sugars, they keep changing. If say you went in the morning and you went for a walk, it's going to drop. If you later on you decided to go and have a nice big breakfast and you said, oh, I'm going to meet some friends and have, I don't know, aloo paratha and something else, that sugar is going to climb up drastically. And then if you decided that, oh, I've eaten too much, I'm not going to eat for the rest of the day, it might start dropping again. But if you check it only once a day, then the only one that you saw maybe was the aloo paratha or the exercise. You have no idea what happens throughout the rest of the day. So that's when we have continuous glucose monitoring systems. And what do they do? So we use them a lot in our clinics nowadays. And they not only educate, they help me as a physician, but they also help you as a patient. And as a patient, you know that, oh, I ate aloo paratha and my sugar went to 250. So maybe I need to either eliminate aloo paratha or maybe I need to eat a smaller piece of it or I need to do something about it. And so this is the size of the little sensor that goes on your arm, which actually is put in by the patient or by the provider for the first time. And it gives you a lot of data all through the day, as this chart shows. And you can show that you're going up and you're going down and so forth. And it's very important to know that how many hours were you actually in target. It's called time in target. And that's very important. Like, were you in target for half a day? Were you high for 8 hours of the day? Were you doing well because your A1C is only going to give you a number and it's going to give you maybe 7.5, but you could be having very highs and very good lows and you will still have 7.5 or 7, but that doesn't mean you're doing very well. So the only way you're doing very well is when you see yourself all day long and to see if you're stable or not. So essentially, it identifies glucose patterns, areas of risk. It tells you whether you're compliant with it. It tells you what to eat. It gives you a lot of education. And it's very easy. You apply it, it gets recorded. The more you scan it, the more it collects data. You come to somebody like me, I download it, and then we look at it together and we say, okay, this is what we're going to do. And each one of these lasts for 14 days on your arm. You take it out, you put a new one on. You can even go for a swim for a short period of time. You can shower. Um, you just need to make sure that that thing doesn't fall out. And this is exactly what I was talking about. I'm talking about you have highs, you may have lows. The gray and the blue, the darkest blue is telling you where you are most of the time. The lighter blue is kind of telling you where you are for some of the time. And the gray gives you like how many times you really had a lot of highs and lows. So it gives you all that, what they call variability. But essentially in the long run, it really gives you a lot of information. So it's important to know that a lot of people go low in the middle of the night. They don't even know that. There are some people who have 70% of their lows that occur at night that they don't even know about. So another important factor of this is low blood sugars. And how do you treat a low? So when you check your sugar, and so the most important thing is people say, oh, I was low and I got up in the night and I went and ate something. And then in the morning, I was 200. So what do you do when you're low? The first thing is check your sugar, whether it's with your sensor, whether it's with your meter, but you must check your sugar. Remember, you always want to know how much money is in the bank. It's very important. You don't spend your money if you don't know what you have. And how you know it is by checking your sugar. So you check your sugar and you find out that you're low in the 60s. So the next thing you do is you go and eat something, and all you need is 15 grams of carbohydrates, 1 5. And how do you get that? You get that from 4 ounces of milk. You could drink 4 ounces of juice. You could drink, you don't want to drink a whole can of Coke. You don't want to go and eat a chocolate bar. You don't want any of those because they have much more than 15 grams. A lot of juice boxes that the kids take to school, those little tiny ones, they are about 15 grams, 16 grams of carbs. If you just keep them with you, that you have to drink the whole one. Once you drink it, you wait 15 minutes and then you check it again. And if it's still low, you do the same thing all over again. So they call it the rule of 15. So to remember that this is a treatment, it's not a treat. You're not going to go and drink the whole soda can. So we're going to talk about COVID. I'm sure all of you are a little bit kind of wondering what happens in COVID. So COVID, if your sugars are well controlled, you can still get COVID, like just like anybody else. But the chance of you dying from it is very, very low. But if your sugars are not well controlled, then you have all the complications that are associated with it, and then your death rate is high. So to say that you're going to get it because you have diabetes, I don't think you're more susceptible to getting it. But when you do get it, your situation is a lot different than other people. So what do you do for diabetes and COVID? There is an increased risk for complications and mortality once you get it. Now, it's very important that you get yourself vaccinated, very important. You wear a mask, you have social distancing, and you do all the things that you're supposed to so that you don't get it. You always want to, of course, have a healthy diet. You want to check your sugars, you want to take your medications. It's also important to have a stock of medications at home for any period of time, especially insulins, because you never know. You've been through a pandemic and you've seen how things disappear off the shelves and how things close down and you may not get your supplies. And so you want to have something at home as some kind of extended period of time. Nowadays you can talk to your physicians through telemedicine. They're willing to help you over the computer, which never existed before. They're doing a lot of video visits, phone call visits, and so forth. You may not have to come in. And with the continuous glucose monitoring systems, the interesting part is that you can actually transmit your blood sugar data via computer to your doctor. So I have a lot of patients that send their blood sugar data to me, and I'm able to see it and I'm able to discuss it with them, which I think is remarkable for the times that we're in. So it's a very important to continue your medications, all your medications, unless you're very severely ill. There are a couple of medications that you want to really be, I'm just going to put in some names. I don't know if any of you know them, but the SGLT2 inhibitors, which are like Jardians, Farxiga, Invokana, they cause dehydration a lot of times. And sometimes when you're really sick and you're not drinking enough water and you're ill, then those are the kind of medications that can get you into trouble because you're not drinking enough and you're dehydrated. They can put you into kidney failure and so forth. But if you don't have COVID, they're good medications and you should continue to take them. And the other ones that are used sorry, this was actually supposed to be an H at the bottom, ACE inhibitors and ARBs, which they should be continued. They're more for blood pressure and diabetes. They protect your kidneys. But if you do develop COVID and you're very, very sick, these are another set of medications that can cause kidney failure. So a lot of COVID patients who are very, very ill, sometimes insulin is your best option. Once you go on insulin, it doesn't mean that once you get better, you can't go off of it. You can always come off of it. Insulin is something where, you just need, sometimes you need something to treat something, and that's what it is. Okay, it's not like a death sentence or I'm going to be on this thing forever, or now that I have it, I'm going, I'm really bad, or any of those kind of thoughts.